My name is Sarah Starpoli, and I'm a physical therapy grad student at a local burn center in Portland, Oregon. Today I'm going to show you how to put on a hand splint and a foot splint. First up, hand splints. Here is a commonly seen hand splint used for burned hands. Hand splints are indicated for burns to the hand, edema control, joint protection, lack of active range of motion by the patient, and risk of contracture. The goal is the best possible outcome for the patient's hand. The position of splinting is wrist 30 degrees of extension, MCP 80 to 90 degrees of flexion, and full finger extension to protect muscle length, tendons, and the extensor hoods of the hand. Precautions are patients with sensation problems, improper donning, and exposed joints secondary to deep burns, which may need additional support, and you should refer to your therapy team if so. Here is a picture of a burned hand that would likely need a hand splint. Before we begin, the fit of the splint should allow patients' fingers to have proper MCP flexion and IP extension secondary to superb OTPT fabrication, so be in communication with your nurse or therapy team about any abnormal coloring or pressure points found on the skin that may have been caused by the splint. Don the hand splint so that the crease hits below the knuckles to get the 90 degrees of MCP flexion. Step 1. Lock. Lock the splint at the wrist. The Curlix is locked twice at the wrist in order to hold the splint into place. Step 2. Pull. Anchor the splint by pulling from between the thumb and digit 2 down to the base of the splint. The pull down to the base should be tight enough that it almost bends the splint, causing it to fit snugly on the hand. This should be done twice. Step 3. Cover. Cover the base of the splint up to the hand with the least amount of Curlix possible. It's important not to overlap the Curlix too much, as longer arms will require more, and you still need Curlix to seal the fingers. Step 4. Seal. Holding the fingers down, tightly seal the fingers and the thumb into place. Notice as the fingers are held into place, they are nearly at the end of the splint. This indicates it's a good hand splint and it's fitting properly on the patient. Lock the Curlix into place with some tape. Remember to elevate. Once the splint is properly donned, elevate the upper extremity above the heart. Elevation helps to decrease swelling, so remember to elevate the arm above the heart, ramping distal to proximal. Common wear schedule. Most commonly, a hand splint will be indicated to be worn at all times for sedated patients. However, this wear schedule can progress to nights only depending on the patient's condition. The therapy team will be in communication about what the proper wear schedule is for each individual patient. Up next, standard ankle splints. Here's what a standard ankle splint looks like. They're indicated for concerns of possible plantar flexure contracture with prolonged bed rest, to float the heels, burns to the knee, calf, and ankle, and burn or damage to the anterior tibialis muscle. This is the neutral foot position that a splint is desiring to achieve. Precautions for a foot splint include improper donning, any red marks from the splint, any ID bands or lines that may cause a pressure sore with prolonged pressure, and it's contraindicated if the patient already has a plantar flexure contracture greater than 15 degrees, unless a custom splint is made. Here's what a plantar flexure contracture looks like. Reminders. Skin checks should be done every time the foot splint is donned or doffed. Any new red marks found on the skin indicates the splint may need modification, so the nurse and therapy team should be in communication about the fit of the foot splint and any red marks found. The skin should be checked for any new red marks or skin breakdown, and any new changes should be communicated to the nurse. When placing the ankle splint on, it is important to get the heel all the way down into the base. If the foot does not want to dorsiflex into the base of the splint, bending the knee may aid with dorsiflexion. Straps should be tight enough to hold, but loose enough that a finger can slide between the skin to prevent a pressure sore. Here, straps are properly donned. Remember to elevate the lower extremity above the heart with pillows, ramping distally to proximal. A common wear schedule is 4 hours on, 2 hours off, which coordinates with the nurse's turn schedule. That is how you apply a foot and an ankle splint. Special thanks to my clinical instructors Joe and Allison, to my lovely actress Becca and cameraman Ryan,